Good afternoon, everyone. This is Group 6. Today, we will be presenting on amyotrophic lateral sclerosis. The group members are Sanika Stewart, Keris Dempster, Natasha Gale, and myself, Brianna Howitt. The objectives for today are 1. Define amyotrophic lateral sclerosis disease. 2. State the possible causes and risk factors of ALS. Explain the pathophysiology of ALS. 4. Understand clinical features of ALS. 5. State diagnostic procedures related to ALS. 6. Discuss medical and nursing management for patients with ALS. And 7. State the complications and topics for health education.
Imagine waking up one day and your body begins to betray you. Your muscles weaken, your voice flatters, and your freedom slips away. This is the reality of thousands of people living with amyotrophic lateral sclerosis, a disease that slowly robs you of your ability to move, speak, and even breathe. The unbroken chain. Living with ALS, a story of hope, a story of strength, and a story of the human spirit that refuses to be broken. Join us on a journey into the world of ALS, where the brave and bold fight for every moment, every breath, and every chance to live.
Definition of ALS presented by Natasha Gale.
Buddy, I am Lisa Graham. I am currently 22 years old. I contracted this disease at age 20. It is called amyotrophic lateral sclerosis, otherwise known as Lou Gehrig's disease. So, based on what I was told, this is a motor neuron disease, and it is a progressive neurological condition that targets the motor neurons. So there are two types of motor neurons. The first group, we have the upper motor neurons, and these neurons extend from the brain to the spinal cord. The second group is the lower neurons, and these neurons extend from the spinal cord to the muscles throughout the body. So, ALS causes both groups of motor neurons to eventually deteriorate and then die. When motor neurons are damaged, they stop sending messages to the muscle, resulting in muscle weakness and twitching. So, the muscles eventually aren't able to function properly.
Causes and risk factors presented by Keris Dempster.
Hi, I'm Lisa's cousin. She was perfectly fine and now she's like this. Lisa, she could walk and do everything on her own, but now she's like this. I've googled some things based on her condition, and based on credible source, there is no known cause of ALS. However, experts believe that genetics and environmental factors play a huge part in the cause of the disease. There are many risk factors for ALS. Genetics, age. ALS risk factors increase with age, and it is most commonly affects individuals between 60 and mid-80s. Gender. Before age 65, ALS is slightly more common in men, but the difference diminishes after age 70. Race. While ALS can affect anyone, it is more prevalent in white individuals. Environmental factors. Exposure to toxins like lead, mercury, pesticides, and smoking can increase the risk of ALS. Military service. Studies suggest a higher risk of ALS among military veterans, possibly due to the exposure of certain metals, chemicals, traumatic injuries, or viral infection.
Pathophysiology of ALS presented by Natasha Gale.
There are three theories for the development of amyotrophic lateral sclerosis. So the first theory is genetic mutation. So mutation in the C9 or the F72 gene can cause ALS. This mutation results in the development of abnormal ribonucleic acid sequences that can cause an interruption in neurons and normal cell functions. So TAR DNA binding proteins 43 mutate and fuse in sarcoma genes which affect RNA binding. So these mutations causes the inability to control RNA metabolism, to protein abnormalities, and the production of toxic intracellular accumulation. The second theory I was told about is glutamate excitotoxicity. Which is basically a decrease in the absorption of glutamate from the synaptic cliff because malfunction of the extracytic excitatory amino acid transporter 2. So the huge amount of glutamate overstimulates the receptors on the neurons, resulting in an excess calcium ions into the neurons. So elevated levels of calcium activated chemicals within cells results in neuronal damage and death. Third and last theory is mitochondrial dysfunction. So superoxide dismutase, one gene mutates causing dysfunction of the mitochondria and making it less efficient at producing energy and more prone to releasing oxygen species, contributing to neuron damage. So the mutation in the SOD1 causes protein to misfold, causing dysfunction, causing disruption of cellular functions. SOD1 mutations and mitochondrial dysfunction impair the transport of important molecules and impulses along axons, crucial for neuron survival and function.
Understanding the clinical features of amyotrophic lateral sclerosis, presented by Brianna Howitt.
Hello, I am Dr. Howitt and I am Lisa's doctor. So the clinical features of ALS. So amyotrophic lateral sclerosis, it is a progressive neurological disease characterized by the degeneration of motor neurons, leading to muscle weakness, atrophy, and eventual paralysis. So the clinical features include muscle cramps, spasticity, difficulty swallowing known as dysphagia, and breathing difficulties along with slurred speech.
Muscle weakness and wasting occur when motor neurons deteriorate, causing a loss of nerve supply to the muscles, thus leading to their weakening and shrinkage. Muscle cramps and twitching, known as fasciculations, arise from abnormal electrical activity due to the motor neuron damage. Muscle stiffness or spasticity results from the brain's impaired ability to control muscle tone after motor neuron death. This leads to increased stiffness and reflexes. Additionally, weakness in the muscles involved in speech, swallowing, and breathing leads to slurred speech, difficulty swallowing, and respiratory issues. This is as a result of the weakness in the bulbar muscles used for speech, swallowing, and breathing.
ALS often begins with muscle weakness in the limbs, making the daily task challenging, and progresses to more severe symptoms such as involuntary muscle twitching and increased muscle tone. As the disease advances, patients may also experience cognitive and behavioral changes, such as frontotemporal dementia affecting behavior and personality.
Diagnostic procedures presented by Carice Dempster.
When she contracted the disease, we wanted to know how they found out. So, diagnostic evaluation included history. If any family member has ALS, electromyogram, EMG. EMG tests involve inserting a needle electrode into the muscle to measure electrochemical activity. This test can demonstrate if there is a problem with the muscle or nerve. Nerve conduction study. The test can determine if you have nerve damage. MRI. An MRI can reveal spinal cord tumors, hemorrhagic disc in the neck, or other condition that might be causing your symptoms.
Blood and urine tests. Analyzing samples of your blood and urine in the laboratory might help eliminate other possible causes of your symptom. Serum neurofilament light levels, which are measured from blood samples, are generally high in people with ALS. The test can help make a diagnosis early in the disease.
Medical management for persons with amyotrophic lateral sclerosis.
So the medical management of ALS focuses on slowing the disease progression, managing the symptoms, and improving the quality of life. Medications like riluzole and edaravone are used to slow the disease, while treatments for symptoms, including managing the muscle cramps, spasticity, pain, depression, and excessive saliva. Respiratory care is essential, and this often involves non-invasive ventilation like BIPAP. Nutritional support helps manage the swallowing difficulties, sometimes requiring feeding tubes. Physical and occupational therapy helps maintain mobility, and speech therapy assists with the communication issues. Palliative care is also important. This addresses psychological, social, and the spiritual needs to enhance the quality of life.
Nursing management for persons with ALS, presented by Sanika Stewart.
Hello, Miss Gail. How are you doing today? Yes, hi. I'm Nurse Stewart, and I'll be taking care of you for your stay at our private hospital. Okay, so how are you feeling?
Feeling alright.
Alright, that's wonderful news. Based on the symptoms of ALS described by the Mayo Clinic, 3 important nursing diagnostic labels in order of priority would include: first diagnostic label would be ineffective breathing pattern related to decreased lung expansion secondary to muscle weakness as evidenced by shortness of breath. Maintain airway patency by using prescribed medication to reduce secretions and or facilitate suctioning. This will reduce the risk of obstruction and prevent choking. Provide oxygen as ordered, as ALS patients might need supplemental oxygen due to difficulty breathing associated with weak muscles that assist with lung expansion. Also, elevate the head of the bed to ease shortness of breath and provide comfort during sleep. High Fowler's position reduces chest pressure and aids in easier chest expansion. The next diagnostic label that's very important for ALS patients is impaired physical mobility, right? So impaired physical mobility related to muscle atrophy as evidenced by muscle weakness. This will cause our patients to have issues with range of motion and so on. Okay, so we also need to assist with range of motion exercises to prevent constriction of the joints, because prolonged inactivity will worsen muscle atrophy and cause joints to become immobile. The next step would be to advocate for gait training sessions with a physical therapist. Using assistive devices will enable the patient to be more active and participate in daily activities, which will enhance the patient's. Our next label would be imbalanced nutrition, less than body requirements, related to dysphagia as evidenced by inability to swallow. It's recommended to provide small, frequent meals to prevent the risk of aspiration and choking with large volume of food. Also, advocate for soft meals to facilitate easy swallowing. These easy-to-eat meals will aid in maintaining optimal nutritional status. Additionally, advocate for liquid supplements between meals to ensure the patient maintains adequate nutrition for any nutrients that might have not been included in soft meals. But also, outside of our 3 labels, it is also very important to provide emotional support for these patients who may be grieving due to sudden life changes. ALS can cause emotional distress, loss of or reduction of motor function, speech, or even the knowledge of a limited lifespan could cause extreme anxiety and depression. It's also important to educate the patient's family on anticipated care associated with ALS. It is also very important to educate the patient's family on anticipated care associated with the ALS disease progression over time. ALS patients may become completely immobile and have increase in their self-care deficits.
Health promotion or educational tips, presented by Sanika Stewart. Here are 3 health education or promotional tips for persons diagnosed with ALS. Number 1. Optimize your home to meet mobility challenges. Make changes to your living space to facilitate safety and ease of access. This includes things such as installing ramps for wheelchairs, rearranging furniture, and installing grab bars as your mobility needs change. Number 2, have regular checkups, which can be critical in managing your symptoms effectively. These appointments provide the necessary details to make any adjustments to your treatments as needed. Number 3, do not isolate. Keep engaging in social activities to maintain good mental health, to minimize and prevent anxiety and depression.
Complications presented by Carrie Dempster. As the disease progresses, ALS can cause the following complications: breathing problems. Over time, ALS can lead to weakness of the muscles used to breathe. People with ALS might need a device such as a MARC ventilator to help them breathe at night. Some people with advanced ALS choose to have a tracheostomy. This is a surgical created hole at the front of the neck leading to the windpipe. Speaking problems. Most people with ALS develop weakness of the muscles used to form speech. This usually starts with slower speech and occasionally slurring of words. It then becomes harder to speak clearly. This can progress to the point where others can't understand the person's speech. This causes them to have to use other forms of communication and technology to communicate to others. Eating problems. People with ALS can develop weakness of muscles involved with swallowing. This can lead to malnutrition and dehydration. They are also at higher risk of getting food, liquid, or saliva into the lungs, which can cause pneumonia. A feeding tube can reduce these risks and ensure proper hydration and nutrition. Dementia. Some people with ALS are eventually diagnosed with a form of dementia called frontotemporal dementia.
ALS is so, ALS is so. ALS is a sickness, it takes over your life, it makes you lose control, it makes you want to cry. You can walk, you can talk, you can eat, you can breathe. It makes your life so long, makes you all alone, makes you feel alone. ALS is so disease you can't control your body at all. You can control.